All right, hi all. Thanks for joining us today as we examine the STOP criteria of exercise testing. Why might you be doing exercise testing, you might ask? Well, exercise testing is to examine the functional capacity of patients. These may be patients after a surgery, after having a cardiac incident, or maybe a patient you're just trying to motivate to get back to full cardiovascular health. Some people who may be administering these tests are physical therapists, exercise physiologists, or exercise physiologist technicians. These are people who understand these tests fully and are able to look for STOP criteria and know how to use each of these tests. Some common tests are the Bruce protocol for higher level patients and the modified Naughton protocol for more lower level patients. A couple of modes you might see for these types of tests are a stationary bike or a treadmill, which we will be showing today.
So our first STOP criteria we have is going to be an ST elevation. Right here you see a STEMI. A ST elevation is indicative of ventricular depolarization and the restart of ventricular repolarization. A patient will be seen to be having shortness of breath, lightheadedness, and some reports of chest pain or angina. This can be indicative of an MI or, like we know, a heart attack. The only way to be able to see if this is an MI happening is an ECG, a biomarker, or other lab findings. I feel a little lightheaded. My chest is kind of tight. I feel like I can't breathe.
Another reason why you would stop an exercise test is if there are abnormal findings on EKG. This could be sustained ventricular tachycardia, Mobitz type 1 block, second-degree blocks, third-degree blocks, things like that. The way you would monitor this is with the EKG leads, so make sure to be observing that.
Feels weird. Not working right.
Uh-oh.
Another reason that we would stop an exercise test is perhaps if your equipment was malfunctioning, perhaps the EKG leads weren't connecting, or maybe the treadmill isn't working.
Another STOP criteria is a drop in systolic blood pressure of more than 10 degrees or 10 millimeters of mercury with ischemia. This may result in your patient being lightheaded or dizzy or even short of breath. When you see this, you want to stop and take the patient's vitals and help them to rest.
I'm a little dizzy here. My arm's starting to hurt.
Another reason that we might stop some exercise testing is if your patient is demonstrating CNS symptoms, such as feeling clammy, nauseous, lightheaded, they look confused. Oh, are you?
Another STOP criteria that we might see is signs of poor perfusion. This is when the extremities might be turning blue and see some cyanosis in the arms or the face, as well as some paleness or pallor, which is whiteness. Some ways to monitor this is by doing a capillary refill test to make sure they get enough oxygen to their extremities, as well as monitoring vitals. You good? You're looking a little sad there, dude. No. The next STOP criteria is moderate to severe angina. This is when exercise-induced chest pains begin to happen. Some vital signs you want to look for are just shortness of breath, them holding their chest, things like that. All right, we slow down here.
And the last reason you may want to stop exercise testing is if your patient requests to stop or they're just uncomfortable.
Can I stop?
2 more minutes. And there you have it. That concludes our STOP criteria for exercise testing. You may want to use these in your upcoming clinicals or if you're doing any testing in the hospital. It's a good way to keep your patient safe and to keep your license.